I am Dr Hrushikesh Vaidya. I am the Medical Director of Horizon Prime Hospital, Thane. So sleep disorders are being recognized for last 15 to 20 years. Before 15 to 20 years, there was no awareness among doctors as well as patients about sleep disorders. There were no diagnostic tools and the understanding was very little. People used to laugh when patients snored and it was considered as a non-serious things. But now we know that snoring is likely that people who snore are having sleep apnea. And there are other major sleep disorders that can impact the patients such as narcolepsy, insomnia, and also shift disorder as well as jet lag. All these can impact patients' life very significantly. So the sleep disorders can really impact the general health of the patient as well as the health of the community and the country. For example, if you have a patient with severe sleep apnea, he may be having severe fatigue during the daytime, he will have tiredness, high risk of hypertension and risk of conditions such as stroke and heart attack. So there is a clear evidence now that sleep apnea can put you at all these risks. Also, we are finding that the spouses of the patients who have sleep apnea do not get restful sleep because of the loud snoring. So it impacts their life also because at night they are not getting restful sleep. Now, we are also having issues such as lack of sleep from other disorders such as insomnia, jet lag and night shifts. All this can impact the daytime functioning of the patient, and this can translate into likelihood of having accidents as well as reduced productivity in work. So there are numerous challenges when we are talking about sleep medicine and delivering sleep medicine care to the patients. First and foremost, it seems that there is a lack of awareness amongst patients that they have a sleep problem. And even if they have a sleep problem, they learn to live with it without treatment. So it is very important that there is good awareness among patients so that they can seek medical care and they can get the diagnosis as well as treatment. Also, we are finding that a lot of doctors are not themselves aware about sleep disorders and they don't have a referral pattern to refer to the specialist. And lastly, the number of specialists who are trained in sleep medicine are very few as compared to the requirement of the population. Another important point is that the insurance, medical insurance right now in India, we are finding it very difficult to get coverage for sleep medicine diagnosis as well as treatment. So I think in future more has to be done for diagnosis and treatment under the insurance umbrella so that the more patients can avail the benefit of the diagnosis and treatment for sleep disorders. At Horizon Prime Hospital, we have a 360-degree approach to treat sleep patients. We have a pulmonologist like me, we have a neurologist, ENT surgeon, as well as psychologist who completely give a care to a patients under one roof. Also, we are part of Nidra Medical, which is a company that is developing innovative devices to treat sleep apnea. We have developed a collar which is used to position the jaw in such a way that it reduces snoring and sleep apnea, and it's in the process of final patent application. So we are into research and development as well as training of patients as well as the healthcare providers at Horizon Prime Hospital.